Hello, my name is Christian Gaperas and I'll be talking about hallucinogen-related disorders. A hallucinogen is one of a class of drugs that results in profound alterations in sensory and perceptual experiences. They cause hallucinations or sensation and images that seem real but they are not. In some cases, users experience vivid visual hallucinations. LSD or D-lysergic acid diethylamide, or sometimes referred to as acid, is the most common hallucinogenic drug. It is clear or white, odorless, water-soluble material synthesized from lysergic acid, a compound derived from a rye fungus. LSD is a powerful synthetic hallucinogen that largely remained in the laboratory until the 1960s, when it was first produced illegally for recreational use. However, the Central Intelligence Agency tested LSD as a truth serum during interrogation, though the agency abandoned their efforts after several serious incidents and no evidence of truth. Hallucinogens are split into two categories: the classic hallucinogens and the dissociative drugs. Some hallucinogens are extracted from plants or mushrooms, and some are synthetic. Historically, people have used hallucinogens for religious or healing rituals. More recently, people report using these drugs for social or recreational purposes, including to have fun, deal with stress, have spiritual experiences, or just to feel different. Here are hallucinogen-related disorders included in the DSM-5. We have Phencyclidine use disorder, intoxication, induced disorder, and unspecified related disorder, as well as hallucinogen use disorder, intoxication, induced disorder, and unspecified related disorders. Phencyclidine use disorder. Phencyclidine, also known as angel dust, is a drug used for its mind-altering effects. It is a dissociative drug that produces feelings of detachment from the surrounding environment and self. Phencyclidine is available as a tablet, liquid, or powder, which may be used alone or sprinkled in cigarettes. Phencyclidine may cause hallucinations, distorted perception of sounds, and violent behavior, and its adverse effects may include seizures, coma, addiction, and an increased risk of suicide. Flashbacks may occur despite stopping usage. PCP is most commonly used in the United States. Phencyclidine intoxication occurs when a person's mental capacity to recognize reality, communicate, and relate to others is impaired, thus interfering with the capacity to deal with life demands. In higher doses, patients become unconscious and can lead to pulmonary aspiration and cardiovascular collapse. Other hallucinogen use disorders involve a problematic pattern of hallucinogen use, including LSD, acid, ecstasy, ketamine, or a medication primarily used for induction and maintenance of anesthesia, mushrooms, peyote, or a small spineless cactus which contains psychoactive alkaloids, or traditionally was often used as analgesic, and etc. Moving on to other drug of abuse, we have inhalant use disorder. It is a problem that can develop when people deliberately breathe into fumes of various substances. Basically, the disorder develops in people who frequently use inhalants as a recreational drug. The effects of inhalants range from an alcohol-like intoxication and intense euphoria to vivid hallucinations, depending on the substance and the dose. Some inhalant users are injured due to the harmful effects of the solvents or gases, or due to other chemicals used in the products that they are inhaling. Inhalants are mostly used by younger people, mainly because they can access inhalants more easily than other drugs, and because they are not aware of the dangers of these drugs. Unfortunately, the use of inhalant is one of the most acutely dangerous forms of substance use and can result in sudden sniffing death even the first time they are used. However, inhalant use disorder refers to a problematic pattern of inhalant use over time, not the acute effects of inhalants, even if they are life-threatening. Moving on to the causes of substance-related disorders. First on the list, we have biological dimensions, which includes familial and genetic influences and neurobiological influences. Scientists estimate that genetic factors account for 40 to 60% of a person's vulnerability to addiction. Genes influence the numbers and types of receptors in people's brain, how quickly their body metabolizes drugs, and how well they respond to different medications. Research found that people who reported abusing illegal drugs were 4 times more likely to have 2 copies of the mutated gene than people without drug or alcohol problems. Genetic factors may affect how people experience and metabolize certain drugs, which in turn may partly determine who will or will not become regular users. Next, we have psychological dimensions, the positive and negative reinforcement. In relation to drugs, positive and negative reinforcement are both required to instill a certain behavior in a person, such as an addiction. When a person takes drugs or consumes alcohol, they may have rewarding outcomes, have fun, and perhaps make new friends. When they are not under the influence, they maybe have negative outcomes, such as feeling socially awkward and shy. These two combined may increase the chance that a dependency or addiction may develop. The positive and negative reinforcement of the drug may contribute to the behavior being repeated.